Hi everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to discuss what to expect and what to do at 3 months out or 12 weeks after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our videos related to knee replacement surgery. So at 3 months out from surgery, you're likely, hopefully, well on your way to being recovered and feeling better and getting back to a better quality of life and activity level after your knee replacement surgery. For most folks at this stage, you're hopefully around 80 to 90% recovered. You're feeling stronger, your mobility is better, hopefully your pain is a lot more reduced and tolerable and manageable. But you might still have some lingering things that you're still working on, still building up your strength, still building up your mobility, your activity tolerance, and you may still have some lingering symptoms, some pain every now and then, some stiffness, some swelling. It's still normal to have some of these things, especially at 12 weeks or 3 months out from surgery. Now, of course, there's going to be a lot of variability between people. Some people may be even better than that and feeling awesome. Some people might be struggling a little bit more, unfortunately, and still have some significant limitations and pain. But in general, you're expecting, you probably want to be roughly 80 to 90% recovered or back to normal, quote unquote. Now, what should you be doing at this stage in your rehab and recovery? Well, one is you want to continue to manage your pain effectively. Now, of course, this is going to look a lot different from, week 1 after surgery. So, if that's taking some over-the-counter pain medicine as needed, maybe that's icing every now and then, not constantly throughout the day. Maybe that means doing some elevation and compression at the end of the day, some massage techniques, things like that. You can still have some significant pain, but hopefully it's continuing to decrease in intensity and frequency as you progress after surgery. You also at this time are likely, if you're not discharged from outpatient physical therapy, you probably are looking to discharge from therapy pretty soon. Now again, there's a lot of variability. Some folks may have discharged a number of weeks ago. Some folks may need a little bit longer because they're struggling a little bit with certain things, if that's your range of motion and stiffness or pain management or whatever that may be. But roughly around this time, you want to consider that sooner rather than later, you're going to be wrapping up with outpatient physical therapy. And what that means is now you have to consider how are you going to manage and take care of your knee and take care of your body and your health without the physical therapy, without the surgeon really, any follow-ups maybe in 6 months or something or a year, but without those resources, what are you going to be doing to manage and take care of your health and your knee? And this includes a home exercise program, doing different exercises and activities at home, continuing with those. It means expanding from that, so maybe that's doing activity, going to your local gym, maybe that's working with a trainer, maybe that's doing other activities and exercises you like, if that's hiking or bicycling, or maybe getting back into different sports like tennis or golf or things like that. So it's kind of making that plan to stay physically active and continue to exercise after you're done with your physical therapy. And it's also just other management strategies. Again, I go back to the icing, go back to using elevation and compression when you need it. We can also think about, pacing yourself and thinking about the amount of volume of activity you're doing. So if you're going for, a really long trip and you're going to be walking a lot, what are some strategies? Do I have good supportive footwear? Do I know, do I have it broken up where I can take rest breaks throughout the day? Things like that, being proactive in staying on top of progressively getting back to what you can tolerate effectively. And you also want to think about, slowly returning to the things that you enjoy, the activities you enjoy. Again, I brought this up before, but maybe that's golfing, maybe that's swimming, maybe that's tennis, bicycling. Maybe that's gardening, maybe it's hiking, playing with grandchildren, playing with children. Maybe it's a return to work, your profession. All of these things, it's at that point, 10 to 12 weeks after surgery where we're slowly trying to get back into these things. We don't want to go 0 to 100. We want to slowly and progressively work back into these things. What's something, maybe if it's going back to work, maybe I can start with half days and build up, how long I'm in work and doing the work. Maybe it's, doing a modified version of things and then slowly getting back into doing them at, your full potential. Also, in this time period, at this 12-week time period or this 3-month time period, you want to continue to be aware of your symptoms, be aware of anything that's going on. Be sure to follow up, ask questions from your physical therapist, give them a call, shoot them an email, stop into the office. Same thing with the surgeon or the doctor. A good doctor, a good surgeon, physical therapist, they're going to be appreciative of you coming and asking your questions and following up with them. We'd much rather you, get your concerns and questions addressed rather than have, lingering issues or problems that aren't taken care of appropriately. And then I would just say the main thing at this point is start to get back into your normal life and activities and things that you want to do, and enjoy life. That's the whole point of having a knee replacement surgery, is getting back to a life and mobility and activities that you can tolerate and enjoy. And so that's the main goal at this point. Again, you're probably not at 100% recovery. You're probably at that 80 to 90% recovered. And it may really take up to 6 months or up to a year even to really feel 100% recovered or back to normal. So give it time, be patient, but start to get back into doing the things that you enjoy, taking advantage of your new knee and hopefully a new lease on life. So I hope this video was helpful and insightful. As always, I ask if you have any questions or comments, please leave them below. Please hit that like button to help spread this video to other viewers. I thank you very much for watching.